Thank you for tuning in to Watson Clinic Health Talk. In case you haven't heard, Watson Clinic now offers chiropractic medicine. Patients can receive chiropractic care from Dr. Jalen Banks from 2 convenient locations: the Watson Clinic Center for Rehabilitative Medicine at 1430 Lakeland Hills Boulevard in Lakeland, and the Watson Clinic Center for Specialized Rehabilitation at 2190 East County Road 540A in South Lakeland. Dr. Banks specializes in the relief of spinal pain, spinal and joint manipulations, cupping, dry needling, and even acupuncture. In this conversation, we discuss all of this and more. Appointments with Dr. Banks may be scheduled by calling 863-680-7718 or by visiting watsonclinic.com/Banks. Dr. Banks, it's a pleasure to have you join us today. Thank you.
Thanks for having me.
So chiropractic medicine, this is so exciting. It's the newest specialty that has joined the Watson Clinic lineup, and people are really excited about it. I'm sure you're sensing that from the patients that you see.
Sure. It's not typical for a chiropractor to be a part of a medical model. So this is about 1% of all chiropractors. We have some larger clinics in the country that have added chiropractors to their staff, the Mayo Clinic, Cleveland Clinic. Those are really the biggest ones. And then here in Lakeland, obviously, we have the Watson Clinic. So we think that the model here is something that's one of its kind, and we feel the future of medicine is having holistic or non-surgical options, preventative care, if you will, a part of the medical model.
And the great thing about the structure of Watson Clinic is you have all of these different specialties, and I'm sure that a lot of patients that go to physical therapy, primary care, even what are some other specialties that frequently refer to you?
Sure. So 90% of my patient base is actually comes from referrals of my colleagues at the clinic. So I want to say the number one referral is probably from primary care physicians.
Okay.
And it might be just a patient in passing say, hey, my back's been bothering me. Do you know a chiropractor, or do you have any treatments for low back pain or neck pain?
Okay. Mm-hmm. So tell me a little bit about what is chiropractic medicine. What does it entail? Why is it such a rarity that a multi-specialty group would bring chiropractic medicine in?
Absolutely. So I'll just start by saying what chiropractors do. So a chiropractor specializes in diagnosing and treating conditions of the spine, joints, and muscle nerves. We have physician status in the state of Florida, so we're able to order x-rays, imaging, even blood labs. We're able to diagnose and create treatment plans as well. So we use spinal and extremity manipulation, rehab exercise, and soft tissue therapies to restore function, reduce pain, improve movement, and often we do this without medication and surgery. But the unique part of this, with me being a part of Watson Clinic, is I'm a part of the larger team model. So, for low back pain, let's say a patient goes to their primary care physician, they might have low back pain, and it's been going on for quite some time. The physician or staff may say, let's try a conservative approach before we get into pain management and a surgical approach.
When we talk about things like spine pain, neck pain, low back pain, what is often the issue? Is it a misalignment, or what causes pain most frequently?
Yeah, absolutely. So, sciatica is a big hot term, right? So, think of inflammation, a nerve being pinched in that area going down the patient's leg. So what we do is we facilitate a healing response in that area by just getting that joint to move and function as it should. So we're triggering a healing response in that area. But we see a lot of common conditions, low back pain, neck pain, headaches, joint and muscle injuries, postural dysfunction, desk-related tension, and my specialty specifically is sports medicine. I'm a certified chiropractic sports physician. Over the years, that definition has changed to me. Before that was, treating high school, collegiate, pro athletes. Now, because I'm a part of a large medical model, my patients range from teenagers all the way. My oldest patient is 97 years
Oh,
old.
wow.
So, the athlete term, it even applies to, I think, grandparents, great-grandparents that have the goal of lifting
Staying active.
staying active, going for walks, enjoying time with their grandchildren, lifting them up.
Yeah, that's great. You mentioned something there. Desk. I forget what the term you just used was, but essentially sitting at a desk.
Yeah, desk-related tension.
Desk-related tension. I think I have that.
A lot of people do. We're not meant to sit for a prolonged period of time. You think about your ancestors, they didn't sit at a desk. Usually you're up and moving about throughout the day. So what we preach in the office is movement is medicine. So you should be standing 5 to 10 minutes every hour you're sitting.
Okay.
So
And what happens? Do your muscles and bones kind of atrophy? What occurs?
yeah, well, that becomes your muscle memory. If you're sitting in a prolonged position for a prolonged period of time, that becomes your normal essentially.
Here's a silly question. I have watched in the past chiropractic videos where they put the microphone really close to the table, and so you hear every pop. What is happening with those pops?
Yeah, that's a great question. So I'll touch on just what the manipulation or the adjustment does. So the manipulation, it restores normal motion to a restricted joint. Sometimes our joints get stuck. Just as you mentioned, you sitting in the same position, maybe on the desk, that becomes your normal.
Yeah.
So it relieves pressure, reduces pain, improves joint mobility, and helps the nervous system function more efficiently. Often at times that you hear a pop, as you mentioned with that, the medical term for that is cavitation. All that is a release of nitrogen gases when pressure inside the joint rapidly drops. You can compare that to opening a soda can, that release of pressure, and that noise, if you will. It's completely normal. It's safe. It's simply a sign of pressure change in the joint, giving you a little bit more range of motion there. A common misconception is that we're putting things back into place. I don't know if you've had any experience with chiropractic in the past, but there's no literature to suggest that things are going back into place. You can't physically alter a structure. So the bones, they move in a way, but not in a dramatic way. We're not snapping bones back into place. We're restoring normal joint motion within a safe and controlled range. It's more like freeing a stuck hinge than forcefully realigning a structure.
So when they say alignment, I guess a lot of people equate that with putting the bone back in place, like you said. But
Exactly.
okay, but that's a misnomer.
It's a misnomer, and it's easy to educate patients in that way. So oftentimes, a patient might come to me and they say that my back's out of place. Mm-hmm. Once again, there's no evidence to suggest that. And of course, my job at Watson Clinic, once again, it's 1% of all chiropractors. So I'm more of an evidence-based chiropractor. All the treatments that we do are evidence-proven. And we're there to get the patient better and, have objective findings proving that we're doing that. That, once again, it's a disproven theory. And oftentimes, someone says, okay, I have a disc bulge or a disc herniation at this vertebral level. Is it actually going to heal or go back into place? So, what I preach is don't focus too much on the structure, focus on how you feel. So if you didn't have pain in that area, you necessarily wouldn't care that you had a disc bulge or arthritis in that area, right? So usually people come in with a complaint of pain or maybe lack of range of motion.
I would imagine that the first step when someone comes to you and has discomfort in a particular area of their body would be an X-ray, would be some kind of imaging to get to the bottom of it.
Sure. So how we practice is imaging, it's not a great tool in defining how someone is feeling precisely. So first, you want to rule out any kind of red or yellow flags. Red flags is usually trauma or more serious things, right? So as long as we don't have those, we usually treat the patient conservatively for a 2 weeks period of time. If we're not seeing improvement, then we can order imaging. And the beauty of it is, with me being a part of the model, is I'm able to communicate this with the referring provider, even the patient's primary care physician, if need be.
And I understand that you have a special table that everyone raves about. What is this table? What's so special about it?
Yes, absolutely. So when I found out I got hired as the chiropractor for Watson Clinic, I met with the director, my supervisor, and I said, hey, manipulation of the spine is a great tool, but I foresee us dealing with a lot more complex issues, and we do. We have patients that have had surgeries in the past. We've had even a couple of fractures come in, not knowing that they had fracture of the spine. And of course, that's an immediate referral to urgent care or the hospital, depending on the severity. But we have a decompression table. We primarily use decompression for any kind of radiculopathy, sciatica. Radiculopathy is just numbness, tingling, pain going into the extremities, whether that be from the neck or the low back.
Radiculopathy?
Radiculopathy.
Wow, interesting word.
So all that is that means you have something, whether that be a structure, a joint, a disc, pressing on the nerve, and that is referring pain or radiating pain into the extremity. So the table, essentially, it stretches the spine out very gently. As it stretches the spine out and alleviates the pressure in that area, blood flow is able to rush in and heal it. So it's a conservative treatment. There's some good literature on it, and it's been very beneficial and effective for our treatment, for our clinic. And we get referrals from all specialists for that. I even have some neurosurgeons refer to me, for that as well.
Now, you sent me something interesting. It was a recent study that showed what the most expensive medical condition in the U.S. is, and it's very surprising.
Yeah, so Forbes, they published an article on July 11th. After reading the article, it's an interesting article, and it poses questions. What do you think that the most expensive medical condition in the U.S. is? And automatically, I jumped to heart disease or diabetes. Yeah. And to my surprise, even this is my specialty, right? It's low back pain and neck pain. Our country spends $130 billion collectively for healthcare expenditures on this.
Wow.
Yeah.
So why is that?
I think it's something that a lot of people deal with, but it's manageable, right? It's not going to necessarily kill you. So I think that's why heart disease and those chronic illnesses get a lot more attention, as they should, right? Mm-hmm. But I think overall, I would love to see the healthcare model shift to more of a preventative model, as we do at Watson Clinic, by incorporating holistic approaches such as physical therapy, chiropractic, and more preventative, as opposed to, let's treat the sickness.
Yeah.
Prevention and maintenance is very important. Oftentimes, a patient will come to me when they're in pain, and then we address that with the manipulation or whatever modalities that we have in place. And they can benefit from maintenance care as well, making sure that, we're keeping things moving and things aren't going back to where they used to be.
How did you happen upon this specialty? What was appealing about it to you?
I start with my parents. My parents had me at a relatively young age. I'm from Atlantic City, New Jersey. So they had me at a young age. My dad, he's an electrician. My mother, she works in a bank. Up in New Jersey, it gets cold in the winters.
Yeah.
So like every kid, my dad asked me what I wanted to be, and I said I want to do what you do. And he says, you shouldn't do what I do because it's rough work. So my dad had a knee injury on the job, and he ended up going to a physical therapist. So from the age of 16 to 22, I actually wanted to be a physical therapist. So I got my bachelor's degree in exercise science. I had a really cool internship that allowed me to work on pro athletes, some of the members on the New York Giants. And, for whatever reason, I just lost interest in physical therapy. So, getting out of school, graduating with that degree, it was a rough time for me because I was like, man, I went to school for this. I'm in this debt that I acquired from going to school. I don't know what to do. So I went to the gym and I was getting back in shape, and I was deadlifting some weight and probably too much than I should. And I hurt my back. And it led me to go to a chiropractor, and they got me better in a few visits. And I said, what do you do and how do I do it? And that's what led me to be a chiropractor. So, when a patient comes to me and they're in a lot of pain, especially their back, their neck, I relate to that because I was once there, and I know, it's something that can help them.
What are the most common questions people have about chiropractic medicine and some of the misconceptions about it?
I guess on the negative side, it's oftentimes people think they just need something, manipulated in that area, and things will go away. So, it definitely helps with pain, but if someone's living a sedentary lifestyle, the pain's ultimately going to come back. So, what we preach in the office is movement is medicine. Make sure we're making some lifestyle modifications, staying active, diet's good, stress level is good. Because stress levels, releases cortisol in the body, and that has a number of different factors that plays into it. So just taking a full approach to it. Another thing is the crack noise, the pop that we touched on. What is that, or is that actually the bone going back into place?
Tell me a little bit more about your work that you do with athletes, because we have some sports teams in this area. High school sports is very big. Do you step in cases of injury, or how does that work?
Absolutely. We have some athletic trainers at some of the schools that will refer me patients. We worked on a number of different athletes at the colleges here in town. I have a great working relationship with athletic trainers at the college, and they'll shoot me a text or give me a call if they need a patient to get in.
Like Florida Southern.
It's Florida Southern, Southeastern University. We've worked on some athletes from there previously. And then, of course, I'm in the physical therapy department, work side by side with them. So they see a number of different athletes, and if they feel like they'll benefit from some of my modalities that I use, whether that be dry needling or cupping, even manipulation, they'll mention that to the athlete, and that's something that we'll co-manage.
And in terms of other services, you also offer dry needling?
Yes.
And acupuncture?
Absolutely.
Could you explain those two for me?
Sure. So about 4 years ago, I did get certified in performing acupuncture. It's a really great treatment that I utilize for headaches and migraines. It's been very effective for our patients. So the philosophy is they both have the same kind of needles. The dry needling needles more addresses trigger points and muscle tension. So I know we did touch on massage. So they say a 5 to 10 minute dry needling session is equivalent to an hour and a half of deep tissue massage. If you think of the body, think of it as an onion. It has different layers of muscles to it. The only way you can get to those deeper muscles is with a needle. So essentially we're facilitating a healing response or a micro trauma in that area by putting the needle in that specific muscle. And we've seen some amazing cases of patients getting better. And we get referrals from this from our orthopedists here at the clinic. I have a couple cases that have had spinal fusions, just neck or low back fusions, and they're doing better overall, but they have a pesky muscle that is holding on for dear life and it won't let go. And those neurosurgeons will refer to us to decrease the tension on the muscle to help out with that range of motion some more.
Oh, wow. And so it generates a trauma response that promotes healing, the healing process.
Absolutely. So you might even see the gold standard, they say, is a twitch response. So you can see the muscle twitching when you get that trigger point, and it's just kind of the muscle resetting and relaxing. So that's another some other modalities that we offer, and it's been very beneficial for our patients here. And we do get a lot of referrals for that, so that's why I wanted to.
No, that's an important kind of supplementary service that you offer. Yeah.
Some great literature on it. So let's say a patient goes to an orthopedist for hip pain, and that patient doesn't want an injection, or maybe they've had injections in the past and they can't get any more. The literature is great on dry needling, specifically for hip pathology, because it's compared to a cortisone injection, and over time, it's minimally invasive, so it has no negative effect on the structure because the needles are so small. But it's a great modality that we do, and we do get a good amount of referrals for it.
That's it for this episode of Watson Clinic Health Talk. Appointments with Dr. Banks may be scheduled by calling 863-680-7718 or by visiting watsonclinic.com/banks. And don't forget, you can find previous episodes of our podcast and subscribe for free wherever you get your podcasts by visiting watsonclinic.com/podcast. Till next time.